Well, the Colorado Coalition for the Homeless provides a variety of housing and health services to homeless families and individuals, not only in Denver and Metro Denver, but across the state. And for the past 25 years, we've been serving the community and growing to meet the need. We've been successful in moving thousands and thousands of people off of the street. We're seeing more and more families and individuals who are becoming homeless for the first time. According to our studies, about 40% of those who are homeless for the first time. Many men, women, and children who never thought that they would be homeless are now turning to us for help.
If it wasn't for Stout Street, I wouldn't know that my heart was even enlarged or I had the problem. So they're trying to get me back on track and get me the stuff that I need to get my leg fixed and my heart.
On this medical van, we would see all ages, from small children to elderly people. A lot of people are impressed with the van when they come on because it does look like a doctor's office. And we would try to give the basic care, get their immunizations up to date, check on them for any kind of communicable disease that we were talking about, making sure the moms are staying healthy. And if they're pregnant, we will initiate care and then try to get them to Stout Street Clinic as soon as possible for more detailed care. We all lament the loss of the van. I worry about the patients that I have seen over these many years on the van, and I'm not sure what they're going to do.
The mobile clinic costs about $250,000 a year to operate, and so as we have gone through budget cuts and had to reduce our operating costs to be able to survive, we had to mothball the clinic. We had to close it down for the time being. So it was probably the hardest decision I've ever had to make.
Well, I was staying in a rundown motel on Colfax Avenue. There was a knock at the door, and I answered the door, and there was a lady there, and she asked me if I was in need of medical care. And I said, "Oh, I'm sorry, I don't have any money or insurance." And she told me everything was free. "Why don't you come out?" And so I did. I was more shocked later that afternoon when the nurse practitioners showed up again with all of my prescriptions again for free. This is a service that absolutely saves lives. My life was saved, and I'm just thinking, as we've had to close this program down, how many lives are being lost to the fact that we're not out there giving medical attention to the poorest of the poor, to those so disenfranchised. And it pains me to think of what would happen without it. Denver needs it.
The very first person the van saw when they first started coming to the gathering place was a woman named Laura, and Laura was aware of the fact that she had a lump in her breast. She was afraid to get it diagnosed. She didn't really know where to go.
So I always came to the gathering place, and when the van was here, if I needed something, it was handy. She looked at it more closer. And then she went and she told me, "You need to get to the Denver Health Clinic right now." And so I did. And if I hadn't went right then, I wouldn't have lived 3 months. That van is very important. It's helped babies, it's helped children, it's helped elderly, it's helped pregnant women.
I was in the motel. I was sick and I couldn't get out of bed. I didn't know what was wrong with me. My chest was killing me. I thought I was having a heart attack. My landlady came and told me, she says, the van's coming. And I'm like, "What van?" She's like, "The Stout Street van." And I said, "What did they do?" She says, "You're sick, go see them." They took me in right away because they could see that I was just gray. I could barely breathe. My pulse ox was like 71. So I went in and they gave me some antibiotics and they started me on some stuff for my lungs. I couldn't get out of bed. I was that weak. I could not get out of bed and get on the bus because I don't have a car. I can't drive. If the van hadn't come, I probably would have laid there and died.
Having the mobile medical clinic at the gathering place has been absolutely key service for the women and children that we serve here. It offers them a sense of convenience and a sense of safety, and also the medical professionals who are on the van specialize in the kinds of health issues that people who are homeless tend to experience. There's something to be said about a community coming together and serving people who are homeless and people who live here but who happen to not have a place to live.
The Stout Street van is needed. It's something that is needed. I've utilized it numerous times. And a lot of times people will put off going to a hospital, number one, because they don't have insurance, and some of them won't even take you. If you put off something that you think may be simple, it turns into something a lot more severe. You end up going to the hospital in an ambulance or spending 2 or 3 days on a hospital, which is going to cost 10 times what it would to have the Stout Street van. I remember one story where I went to Denver General, and there was a prescription that I needed after I had been seen, and I just plain did not have the $7 or $8 that it cost for this prescription. So I put off getting this prescription for at least a week.
But if half of those people went to the emergency room instead of going to the van, the cost to the community would be about $1.4 million per year. So the cost savings of what you would be giving to the community would be enormous. Also, I think what I would tell people is you're being part of a really significant solution to healthcare. Healthcare is a big issue throughout the entire country, and you're part of the solution, and you have an opportunity to give back and to make the community a better place.
If the van don't come around anymore, a lot of people will probably die.
I wish I could write a check. If I had $250,000 to give, I would give it right now if it was my last dime. Because if it wasn't for this program, I wouldn't be alive. And I would give anything to save even just one life. It's so important.